Starting in Dennis's big bag, we actually have what we're going to start with mobility. It's actually not where you would start in an order of care of needs. Obviously, massive hemorrhage is going to be what kills you first. That's what you're most concerned with treating. So we'll actually start down here in the middle and we'll kind of work our way back across. Gloves, starting point, anytime you can. Most of the time people don't think about it. But just in general, if you can, always start there. Here in this bag, he actually has Israeli bandages, Curlex, 2x2 gauzes, other regular gauzes, the 4x4 gauze pads, occlusive dressings and non-stick wound dressings to seal. So if you have any sort of penetrating trauma or anything else that you're otherwise trying to seal off, can be used for if you have a burn as well. Not just a penetrating injury, but it works for burns as well. Down to the little boo-boo kit, but you wouldn't be on that just yet. Also, Maxi Pads, they're designed for one thing: stop and absorb blood flow. If you don't have anything else, you can have these at home. Use these. These work about the same as the 4x4s. You don't want to really, you're not going to want to pack this into a wound. So then, moving on towards the mobility section, SAM splints, finger splints, the triangular bandages you can use to make a sling out of. If you don't have the sling previously, I know Dennis actually displayed how to actually use the shirt to actually come back around and make a sling if you're trying to immobilize an arm. You can do that a number of ways, either still with the shirt on, or if you need to take it off, if you can get it off or cut it around to make whatever you have there. Ace bandages, you're going to have to use those with the SAM splints. Otherwise, you have to use tape of some description. You'll take this, you actually pull one out, you'll mold it around. Grab this one, orange one, because it shows up a little better, smaller. You can either take it and cup it and go around however it is that you need to splint or brace whatever you're doing with the SAM, and then you'll actually tape it to however that needs to go, or use the ace bandage. You got the alcohol prep pads for cleaning things off, antibiotic ointments, all those kind of things. This is more in a boo-boo kit style deal. You're going to skip all that if you go into something with a massive bleed, laceration, whatever. Burn gels. So if you do get burned, something like that. For the mobility side as well, go into the cold packs and the warming packs to get people to where they can move around. Heat and ice. We actually skipped the tourniquet. Did see this on the bleeding. For the most part, on a massive hemorrhage on a limb, this is your go-to now. It's direct pressure till you get to the point that you can get there. Then we go from there. Cold and cough medicine, allergy medicine. Pain meds, obviously they're going to be specific to each person on a prescription basis. Advil, Tylenol, nighttime pain relief. Glow sticks, so you can see what you're doing, so you can mark an area, especially in an area like this. If you're needing to do a recovery or you need to mark something, those come in handy. Menthol Items, icy hot, deep heat, Vicks 44 rub, petroleum jelly, a number of uses from the standpoint of helping with wounds, injuries, boo-boos, starting a fire, insect bites, poison ivy, any of those stuff you can actually do with the menthol based products will help with that. Razor blades, water filter. So when you're in this situation where you need water, you actually have that in your bag. CPR mask, So if you are needing to do a mouth-to-mouth, you would actually want to have that. There again, the rule of thumb is if you're thinking about using this, you probably ought to have gloves on also. It's a larger.
Homemade Israeli bandage.
Okay, I was like, I'm about to unroll your Israeli bandage here. Don't want to throw that on the ground.
That's a homemade one. That's what the Kotexes and things are for, besides hygiene for the women.
Definitely. Insect repellent, especially this time of year. Vitamins, hand sanitizer, charcoal for ingestion if you have ingested something that may or may not be toxic and you're not sure. Charcoal, it's also an anti-diarrheal, so if you don't have anything else, if you take several of those, it will stop it. Rubbing alcohol, iodine, some vitamin E skin oil, and then castor oil. If you have just the opposite issue and you need to go, then you have the castor oil. Whoa, dear. And your radio. So for comms, if you're in this situation. Did we miss anything? Well, Jello.
Yeah. Electrolytes.
Yeah, electrolytes can be used for a lot of other things. Also be good for morale. If you're in a bad place, any little creature comfort make you feel better. So we have that. So we miss anything there?
Nope, you got that pretty much covered.
Perfect. All right. Moving down to the next table is actually going to start with wound instruments, suture kit. So your first.
I need to move those two big bags.
No, we're fine. I'll stack them down here. I just don't want to lay them down and pour your stuff out.
It'll be all right.
Okay.
Throw it in there anyway.
So you do have actually in this kit there is a needle. So you've actually, and they actually do have a set of sutures here. Your scissors, needle drivers, tweezers, forceps, and then so as you go through here, your needle driver and these forceps are actually going to be your two most important part if you're actually suturing, because those are going to be used the most often. But this thing folds up, so you got there filaments, extras there. Another field surgical kit that you have.
What's wrong with it?
A lot of the same components, but you do have in this one antibiotics, alcohol prep pads, actually some Needlenose forceps, a large needle, flashlight, which actually has a pupil gauge on it as well, so you can tell what should be in the normal range to fully blown to fully constricted. And each one of those is going to represent a different mechanism of injury, whether it be a drug overdose, a head injury, a loss of blood, any of those kind of things. So it's good as a guide just to look and say, okay, this is what we're looking at. Skin staples. So you've got these. These are disposable, but there's 25 staples in each one, much like the sutures.
Do you have to have a gun with that, or is
These?
it just, yeah?
This is it.
Really?
Yep, that's it all together.
I'll be there.
So they're actually a whole lot smaller, though. I've got a big one in my truck.
Yeah, I've seen them about that big. And
yeah. These now are a lot smaller, but it's, I mean, okay, so there's different widths of a lot of them, but these are going to close most normal things that we've got, you would ever have to deal with around the house. Let's see. While we're looking at it, Superglue can be used actually in the same way. Closing wounds, closing smaller wounds. You're not going to close massive bleeders with that at all. We're into more sutures.
Yeah, safety pins,
Safety
this is
pins.
closure stuff.
Closures, saline lock, your first aid book, and a wilderness and travel medicine guide. If you need any of those type things.
I keep one of those in every kit, one of those books.
Then this is one of your basic kits that goes in. So have you got this sub-kitted inside this kit, or is this one all together by itself?
It's all together by itself.
Okay. So we'll come.
It's standalone for when we take pack trips or something like that.
Okay. So we'll come back to that. This is all dental. So you have any kind of dental emergency, you lose you lose a filling, you break a tooth, a crown, dental hygiene needs, all that stuff you actually have here, even Advil, some files, things like that are in there. Another adventure kit that actually has dental parts in it as well. Ambisol, Motrin. This is actually what I was looking for. A mirror, so you can actually see some of the stuff that you're actually dealing with. Otherwise, it's going to be really, really hard to see sometimes.
I always carry small mirrors too in all my other packs. If you get something out of your eye, something like that,
Yeah,
you've got to have a way to see to do it.
absolutely.
And that's the only way. And everything in that dental kit will fix just about any problem you've got except pulling a tooth. I had probably 9 dentists going on me when we put that together.
Truthfully, if you have to extract a tooth,
Good luck.
yeah, I mean, it's going to be, you're going to be in a bad way if you have to do that. If you've got locking forceps, especially this style, hemostats that lock in and you can get a hold of it and you've got the stones to actually pull it out yourself, if it's broken, it's going to come out in pieces and it's going to be bad. But if it's, if you can get this thing in there and locked in and pop it out, good luck, but you're probably only going to get one shot.
How about an ice skate and a rock?
You could. It makes a good movie.
On those,
Yeah.
the forceps like
make
that,
sure
if
your
you have a
volleyball
tooth
friend
broken
Yeah.
and the tooth is out, usually you can use those to pull the small shards.
Right.
Or a set of small needle nose pliers. And that's what they use at the dental clinics
Right.
all the time. They'll pop them out. And you can get a set of dental tools relatively cheap right now from Amazon.
Well, and if you have pain meds and you can take something like that, great. Ambisol obviously is just going to treat anything with lidocaine in it like that that's topical, is going to treat in somewhat, but once you start pulling on stuff that's root attached. Now, if you've had a root canal, you don't have a root, and you break the tooth, pull it out. It's not, I mean, all you're going to feel is what's in your gums. You're not actually going to get the root pain from pulling it out. So it still won't be pleasant, but it won't be as bad. I mean, I've never had to do this myself. I know people that have. If somebody breaks a tooth off like that and it still is root attached, you reach in there with an instrument and you're not numbed up and you go in and hit nerve, hit all that stuff. Just wear gloves if you're going to do that to somebody else, just because, I mean, you do it yourself, you probably still want to, even if you cut your own self on what's in your mouth. But just, you're probably going to get one shot, but just be careful. Try not to break your teeth off to begin with anyway. But it happens in the freakiest ways. As far as some other of the boo-boo stuff that we're looking at here, Preparation H ointment, antifungals. There again, some prescription meds, pain meds. Clindamycin is a very, very, very strong antibiotic. There again, this is one of those that you may want to be a little careful with. If you do have this and take it, it will, in a good number of people, will cause stomach issues. So if you do find that you do have that, then make sure you have some of the other preventatives as well. That can happen a lot of times with any antibiotic, but this is available. I mean, almost every doctor will prescribe this now. It's actually prescribed more to ladies than just to men, because it goes with more of their specific, it responds well to specific female infections. Advil, acetaminophen, Advil, Chigorex, menthol product as well. Helps if you had chigger bites, bug bites, skin issues, more prescriptions. Vicks Vapo inhaler, these are wonderful. I carry one of these most of the time during the winter and the spring with the allergy season. This stuff will get you opened up. If you're having some trouble breathing, allergies, you're feeling real stopped up, hit those a couple of times. You don't want to go to it too much, Put it a couple of times an hour for here, see if it gets you opened up. Can get all that stuff draining back out. You won't have those issues.
Carmex is another good one.
Yes.
You take Carmex and just put under your nose, it'll help open you up too.
The Vicks Vaporub.
Yeah.
I mean, all that stuff is wonderful. The Vicks Vaporub also, if you don't have another topical antifungal, anything like that that has the menthol and alcohol in it as well will actually work on skin and nail funguses. So anything that's a bloodborne fungus, so the stuff that grows under your nails and all that stuff, it's not going to treat that because that's actually in your bloodstream. So when they have the oral antifungal medicines you have to take, it's not going to touch that. But anything else, there's tons of uses. Google it. It's used worldwide. I mean, we actually use it for a very few number of things that people around the world use it for. Hand sanitizer, again, keep yourself clean. Light fires with it, sterilize things, general cleanliness. Packing strips. Moving actually into a different. This is the same table. This is all the same out of the same bag, the go bag.
That's
Okay.
out of my camp bag.
Okay, this is out of your camp bag.
It has a lot of the same stuff that the bigger bags do, because I usually go with a lot of kids.
So same, the 4x4s, the Sam splints that we looked at earlier, hot hands, cotton applicators. If you're needing to get something into a hole or out of, if you're needing to put direct pressure, if you're trying to extract something, you can actually use these, bear pressure down on them, and actually twist skin around. You can actually use these to remove ticks also. You get on them, spin them around in a circle, they'll come out, pull them out. So these are skin swabs, sterilization for wounds, Band-Aids, tongue depressors, the wood tip Q-tips, which are going to be the same thing here, butterflies, if you need to go to an injury like this that is not under a lot of tension, but you can just keep it closed long enough to get to a place where it's going to be fine. You can, if you don't have a suture kit, you can use these. I mean, you can stack them on top of each other and then cover them. Most of these are now, the ones that make are waterproof-ish, but they'll stay on for a long time. Imodium tablets, prescription, there again, Imodium pills, because if you get into this situation, you don't want diarrhea where you're going to lose a lot of fluid. So keep those in there. More triangle bandages, finger splints.
I like the metal foam ones better
Yeah.
than those plastic ones. But at the time, they were cheap, so I picked them up.
No,
And they work. They're
if it works, it
reusable.
works.
And that's what the tongue suppressors are for, too, is another
Yeah.
alternative.
Got those. Tape in one or more, or you can tape it actually further down the hand if you need to stabilize a front or back, depending on what you're trying to do. What do we got here? A tourniquet, antibacterial wipes. These are actually, bacterial antivirals, anything like that. They're also good. What we looked at earlier is if somebody gets in poison ivy, these will actually dry your skin out. Same thing with chigger bites. When you do a bleach wash, basically you're getting the same thing out of these. So you can do, to dry the skin out, you dry the skin out, it dries out, dries off. That's where those oils and the irritation are living anyway. So it takes that stuff off.
There's several items that I'm missing. I've got on my list at home about 10 items. Some of them have been a grill, different things like that are really handy.
Well, you've got antihistamines in some of your stuff already, so I mean, I would look to see that it's not the same antihistamine, just under a different brand name. I keep Benadryl in mine, actually the store brand, the multi-packs that you can just throw at people.
I keep
What
some
about
of it for
the over
kids, and then the other for adults, and then I give it to my dogs when they get snake bit,
Absolutely.
and then I shoot them with